Okay, let's be honest, doctors say a lot of really stupid things about your health. And sometimes even when they're saying things that are totally true, they just sound a lot scarier than they need to be. So let's break down some stuff that your doctor might have said and why it doesn't need to concern you too much. A full course on low back pain is coming soon, but I want your suggestions. Please comment below with something you'd like to know about low back pain, because when I make this course, it's going to be evolving based on what you want to know. And if you want to download the notes, go become a member. Now, sometimes low back pain does have really serious stuff going on behind the scenes. Sometimes back pain isn't just back pain. That's why it's really important that you go see your doctor, because they can use these algorithms and they understand differential diagnosis, so they can try to rule out red flags and make sure that you don't have something very serious going on that is causing your low back pain. Please see a doctor, make sure there's nothing serious going on. It's almost never the case, but you don't want to be that one rare case and have done nothing about it. So now let's talk about common stuff that goes on in the back. So here's a funny word that doctors use, a radiculopathy, and it sounds just about as ridiculous as it is. Now, a lot of people think they have a radiculopathy when they actually don't. So if you have pain that shoots from your back, down your leg, and into your foot, then maybe you have a radiculopathy, but maybe not. Only a doctor is going to be able to tell for you. What a radiculopathy is when a disc herniation here compresses the nerve roots as they exit the spine. Now, this causes a telltale lancinating pain, which is a tight band, a narrow band, not a diffuse kind of vague, feeling of radiating pain, but a tight band of pain down the entire leg into the foot. Now, the good news is that a lot of non-surgical options, a lot of exercises like McKenzie exercises, nerve gliding, these things tend to be helpful for a radiculopathy, and these are the things that your doctor will hopefully have you try first before they even consider surgery. And again, to be reassuring, you don't need to panic, because nearly 50% of cases will go away on their own within 2 weeks, and actually up to 90% of people with the radiculopathy will resolve within 6 to 12 weeks. So chances are, if you just wait it out, you'll be okay eventually in the long run. You don't need to rush into surgery. However, there are a couple of cases where radiculopathy can be serious, so you need to see your doctor urgently if you have numbness in the groin, which can be a larger problem with the spinal cord and nerves exiting the spine. And we would see if you are having any kind of incontinence with the bowel or bladder, if you're kind of leaking or unable to hold your pee or number 2, then that's a problem. Go see a doctor urgently. And if you experience a sudden onset of muscle weakness, or you're noticing a lot of muscle weakness in that foot or toes or something like that, or you're tripping on your toes a lot, then you need to go see your doctor urgently. It still may not be a huge deal, but you need to have somebody managing your back pain for you. However, the good news is a lot of times people think they have a radiculopathy, and here's what's really going on is sciatica, which is kind of a vague term. It really doesn't mean much. Some people think sciatica is more like a pinched nerve, which we would call like piriformis syndrome. So sometimes it's useful to stretch out the piriformis muscle. That's like a peripheral nerve entrapment. All that means is the nerve goes through some muscles, the muscles are tight, and it pisses off the nerve. So maybe stretch it out a little. However, there are other reasons that you might feel pain that kind of goes down into your butt or your leg, and that could be just that one of the joints in the spine is a little bit sensitive, and it causes what's called somatic referred pain, which is basically the brain doesn't know the difference sometimes between sensation in a joint and sensation in the muscle. I can explain that in another video, but basically it doesn't know what's going on, so you feel it in a bunch of places, even though there's nothing wrong with your muscle. The thing that comes up all the time really is discs. And people tend to freak out when they think there's something wrong with their spinal disc, that their disc has slipped, or they have a bulged disc or herniated disc. But again, don't panic. Most of the time, if there is anything going on with your spinal disc, it's not a big deal. Actually, most people have disc degeneration, which is just normal age changes, and they don't have any symptoms at all. And not just degeneration, even disc bulges are common, and they don't necessarily predict whether or not you have pain. So you can have a disc herniation and have no pain at all. But the cool thing is, even if you do have a disc herniation, 66% of them heal on their own spontaneously with no treatment at all. Now, I should note here that disc imperfections can influence and make it more likely that you will experience some pain at some point, but they do not doom you to a lifetime of pain. So again, we don't need to panic about it. Another common structure that gets blamed for low back pain is the facet joints. Now, this is a spine. You're looking at this spine from the side view, and we see that these little joints right here, basically that go all the way up the side of the spine here, and they're just little gliding kind of joints. They just, two surfaces glide against each other. Now, sometimes they can get a little irritated, and that causes some pain. Again, though, we find that asymptomatic people with no pain, tend to have some facet degeneration, but it's really not a big deal. It's basically normal age-related changes. Now, what you actually might feel if the facet joints are irritated is that the muscles in the same area might be irritated as well. So you might feel that your muscles are painful, but guess what? Your muscles are probably just fine. So all that soft tissue work, all that deep massage on the muscles might not be addressing the joint issues that might be going on. Because what's happening is we can think about the nerves that go from the joint and the nerves that go from the muscles as two different bus lines. And those bus lines go and they meet at a station. That station is your spinal cord. Now they get off and they transfer to a new bus that goes straight up to the brain. But we can't necessarily tell once they've got off at spinal cord station which bus they came from originally. So the brain, all the brain knows is they came from spinal cord station. It can't tell the difference, and so the brain thinks that the pain came from the muscles when it actually came, or I should say the nociceptive signal came from the muscles, but when in reality it actually came from the joints. Next up, sacroiliac joints, or your SI joints. Good news here, these joints are super strong and sturdy. Now we do have some tests that a doctor can do to tell if it is a pain generator. However, a lot of doctors will tell you that your SI joints are off or out of alignment or rotated or something like that. And the tests that they use in a clinic to determine that are just not reliable. So we see that research tells us we cannot accurately assess the motion of these joints, but it doesn't really matter that much because they do respond well to exercise and non-invasive treatments. Now, a lot of PTs and chiropractors love to talk about joints and alignment and your leg, you got a short leg and you got a curve here and this bone is rotated funny. The problem with that is that if you look at any human being, you're gonna find some of that. So how much does it really matter? Well, basically our research shows us that, for example, if you had a short leg, a lot of people think, oh, I got a short leg. Well, does it matter? If it's less than 20 centimeters, no, it really doesn't influence pain. It's not a predictor for pain, so it's probably not a big deal. And the tests that they use to measure it in a clinic are inaccurate anyway, so if they tell you you have a short leg, they're probably wrong anyway. And what about your spinal curvature? Oh my God, you got a rounded back, you got an arch back, you got a sway back, you got lower cross syndrome. Well, we find that spinal curves are not really strongly correlated with your pain, so probably not a huge deal. Now, it is important to note here that some alignment issues are a really, really big deal. Now, those are the kinds of things that if you go to a PT or a chiropractor and they see these things, they should be sending you to a surgeon or some other, a neurosurgeon or orthopedic surgeon, because these things are a very, very big deal. So things where the entire bone slips off of the bone below it and falls down and squishes the spinal cord. Now, don't get freaked out. This almost never happens, but it is really important to understand that yes, sometimes alignment really matters a lot. So it's like, but then you see these people with insane, really messed up spines, and even they sometimes have no pain at all. And it just messes with your head. You're just, how do these people have no pain? And then you ask yourself, why are we freaking out about people who have one vertebra that's slightly rotated one direction? Does that really matter? Very likely it does not matter at all. Now, can posture influence your pain? Sometimes, sure, but it's nothing to panic about. So another one you might hear is that you have tight muscles or weak muscles. But we find that, so there's a syndrome called lower cross syndrome. Basically your pelvis tilts forward like you can see in this drawing. And then we have like tight muscles on one side and weak muscles on the other side. It doesn't really matter. Basically we find that there's not a relationship to these muscles based on this Yonda's idea of lower cross syndrome, that when you study it with EMG studies, it's not the way we expect it to be. mobility. Also, part of this concept is based on an outdated theory of reciprocal inhibition. That doesn't really exist in the way that we think it does, and if it does exist at all, it certainly doesn't produce these huge global effects that can cause disastrous outcomes for pain. That said, if you feel like you could develop some more strength and mobility in certain areas, there's nothing wrong with strengthening and stretching. That's fine, and you should do it if you like, but you don't need to frame it in your head like, my body is messed up, it's out of alignment. You can work on the strength, work on the mobility without having a mindset of like, my body is bad. What about bad lifting technique, right? So unfortunately, we have some conflicting research on like, can you pick up a heavy thing with a rounded back? Is that safe? I'm in the camp that we should try, if we're picking up very heavy things, to maintain a good technique, but that if we're doing things that are unloaded, like crunches and sit-ups, not really a big deal. So just some reassuring stuff, deadlifting is safe as long as you progressively ease yourself into it. And actually, if we get too obsessed with your form, then you actually make people move worse. They perform worse if they get too obsessed with their form. So sometimes you just gotta let people move. So here I've tried to bring some balance between biomechanics and structure and then pain science, where on one hand we say it's like, oh my God, your head is forward, your shoulders are forward, and it's gonna, it's wrecking your neck. Oh, if you don't move just like this, it's gonna destroy your spine. Well, that's not really true. But on the other hand, pain science can sometimes leave you feeling like, oh, great, so my pain's totally in my head. I'm just making it up and posture has no relevance. So either extreme position is silly, so let's not live in the extremes here. And we can just basically say that, form and structure can have an influence on pain and function, but it's not that you need to panic about it. They don't doom you to a lifetime of pain. They may have some influence sometimes for some people, but you don't need to freak out about it too much. Next time, I'll teach you how to do a self-assessment. Real simple, keeping it easy. Remember, if you want these notes, you can download them if you're a member on my website, and I'll see you in the next video.